My first guest is Dr. Walid Abu Jawdi, or commonly known to his patients as Dr. AJ, a general surgeon with Lexington Surgeons, and also a member of the board of the recently accredited breast center at Baptist Hospital. And that's a big deal, reaccredited, I should say.
It is. It's the National Accreditation Program for Breast Centers, and we've been involved with this program for about 6 years now. We've had our accreditation just 2 weeks ago, and that's for 3 years. And it's a big deal for us, and it's a big deal because we pretty much adhere to the highest standards as far as taking care of patients with breast disease, whether it's benign or malignant.
Well, when you talk about breast disease, who's at risk? Is there a particular patient profile of risk for breast cancer?
Well, any woman is at risk for breast cancer. We know that 1 out of 8 women in this country are at risk for developing breast cancer, which is about 12% lifetime risk. And that risk goes up as women get older. So definitely every woman is at risk. Some are at higher risk, especially women that have a family history of breast cancer, mom, sister, grandma, or ovarian cancer on mom or dad's side. And some women are genetically predisposed to having the breast cancer disease because they have a gene mutation that comes down to them from either side of the family. So it's good to know all of that when we see a patient with breast disease. Some women with dense breasts are definitely at higher risk. Some women are at risk from the hormonal exposure that they have, whether it's having menarche before age 12, having menopause later in life, 55 and above, and then women that have first pregnancy after age 30. We know from data that they're at higher risk for having breast cancer. So women that take birth control pills, hormone replacement, they're all at higher risk.
So if you're a higher risk, or for that matter, just anybody, mammogram is a big deal. But it's been a big deal, and do you do it or do you not do it, and when do you do it? What do you think?
Well, the mammogram is the gold standard for diagnosing breast cancer. Like we said, every woman is at risk. So every woman as the woman gets older, you have to make sure that you do the mammograms. And this is the Breast Cancer Awareness Month. So we encourage all women to get their mammogram scheduled if they haven't had one this year so far, because you need to diagnose breast cancer early on. And the mammogram is the gold standard for diagnosing the disease early on before you feel the disease. You know, by the time you feel the mass, by the time you see the induration in the breast, or having bloody discharge, or having redness in the breast, that's a little bit later in the stage. And we know that women do much better. Survival rate is by far better when the disease is diagnosed much earlier, and that's where the mammogram comes in.
Is there any specific age, or is that a matter of debate as when you start?
Well, there's been debate back and forth over the last few years. We still recommend age 40 and above to get a yearly mammogram. The American Cancer Society strongly recommends it after age 45. And we know the risk goes up as we get older, so definitely you have to continue with that. And then you can go as long as the woman is doing fine and still have a life expectancy of 10 years. We say, yes, get your mammogram. It's okay.
So let's say you do the mammogram, you go through the biopsy procedure, and you have the diagnosis of cancer, which is something everybody hates to hear. There's treatment options. You as a surgeon, tell us about that and some other options.
Well, the treatment for breast cancer is multimodal. In a sense, you need a comprehensive, multi-specialty approach to treating it. So once you make the diagnosis, and then we have the breast center radiologists that help us with that when it comes to the mammogram, doing the needle biopsy, and then refer to the surgeon, where we talk about the options for treatment. The options have not changed dramatically over the last few years. Surgery still is the mainstay as far as getting rid of the disease, staging the disease. So we can get rid of the tumor by doing either a lumpectomy, where we remove the breast cancer, save the breast, and then radiate the breast, or a mastectomy, where we remove the whole breast, and then we stage the disease by checking the lymph nodes in the armpit to see if it has spread beyond the breast. And then after surgery, then we move on to radiation if the woman still has a breast, or if there's extensive disease in the axilla, we recommend radiation even with a mastectomy. And then we move on to the medical oncologist to help us decide what kind of treatment the lady needs to prevent the cancer from recurring or showing up anywhere else in the body.
And survivability and treatment has come miles from years ago.
It sure has, and just in the last few days, the CDC came out with a report saying that mortality has gone down because of the use of mammograms. So that's why we encourage all the ladies, please get your mammogram. Very important.
Great information. We thank you for coming in. If you haven't got your mammogram, you need to do so. We'll be right back.